She's a little tired.
Hi, my name is Gabby, and I'm a nurse from the University of Detroit Mercy, and I'm here today to do a head-to-toe assessment on you. Wash hands and then provide privacy. And your name is?
Hannah Emmer,
Date of birth?
September 29th.
Okay, and where are you today?
A hospital.
Okay, so patient is alert and oriented times 3. Her mood is pleasant, content. She is overall good hygiene, no smells, good grooming. Her speech is well. Do you have any pain?
No.
And any allergies?
No.
Okay, so to start off, I'm going to start looking at your head. And to begin, it's going to be at your hair. This sort of hair is thick. It's well groomed, no parasites, no dry skin in there. Pretty good. Your head. So her temperature is warm to touch. Her skin color is appropriate for ethnicity and uniform throughout. And there are no lesions on the head, so there would be no need to do the A, B, C, D, E rule. So put your eyes down. I'm going to have you stare straight ahead. Eyes are symmetrical and umbrella, so the pupils are equally round and reactive to light and accommodation. Look for your conjunctiva. Pink and moist. I'm going to look inside your mouth. Okay, so mucous membrane is pink, moist, no lesions. Can I have you Okay, so your uvula vibrates and it does not touch the tonsils in there. So they'd be about 1+. Okay, and then smile. Okay, gums pink and moist, no retraction. Teeth are white, none missing. Tongue is pink and moist, no white spots in there for infection or anything. Okay, now for your face, I'm going to touch parts of your face with this pen and tell me what parts they are.
Forehead. Nose. Cheek.
Okay, and then I'm going to have you smile, and then puff your cheeks. So cranial nerves 5 and 7 are intact. And then again for her face, the color and everything was uniform, no lesions or anything. So now I'm going to look at your neck. I'm going to palpate for your carotid artery. Okay, so they're about a 2+ bilaterally. And I'm going to listen to them with the bulb of the stethoscope. Okay, so again, 2+ bilaterally, no bruise or anything in there. And then no jugular vein dissension is present. So now I'm going to take a look at your upper extremities, your arms. So they're uniform throughout, hair and evenly distributed. Skin is appropriate for ethnicity. Let's see your temperature. So warm to touch, everything bilaterally. No lesions. So capillary refill is good, it's under 3 seconds. There appears to be no clubbing in any of the fingers. Nails are well groomed. And I'm just going to have you grab on. Okay, good job with that. Now I'm going to listen to your heart sounds. So I'm going to start with your aortic, which is at your second right intercostal. Your pulmonic, which is at your second left intercostal. Your herb, which is your third intercostal. Tricuspid, which is your fifth intercostal at the left sternal border. And then your mitral is at your fifth intercostal at the left midclavicular line. And I listen here for 1 minute for the apical pulse. And I'm just going to go back in reverse using the valve. Mitral, tricuspid, the herb, pulmonic, and aortic. So there's no dysrhythmias or murmurs or arrhythmias, so your heart beats are regular. Now I'm going to start with your lung sounds as well. you breathe in and out. Okay, and then we go to the back. Breathe in and out. Okay, so your lung sounds are good. They are clear. You hear that nice whooshing sound. No adventitious sounds in there. Now I'm going to test your coastal vertebral angle. So I'm going to cup right in the side and fist. And if you feel any tenderness or pain, let me know. Okay. Okay. And then the anterior posterior diameter is appropriate for her gender and ethnicity and everything. So it's a 1:2 ratio. And then her spine, it's an S curvature. No signs of any deformities in that. And then I did forget to do the brachial and radial pulse. I'm going to go back and do those. Brachial, 1+. 1+ bilaterally for both of those. And then okay, so those are 3+ bilaterally. Okay, so now I'm going to have you lay down and look at your abdomen. So for inspection, no lesions on here, appropriate color. And then I'm going to auscultate for your bowel sounds. So I'm going to start at your right lower quadrant because that's where you hear the most sounds. Up to your right upper. Left upper. Left lower. So the bowel sounds are active. Must be hungry. Now I'm going to percuss throughout your abdomen. Okay, so everywhere was there wasn't any noise except for the spleen and liver, which had some dullness to them. And I'm just gonna palpate. Do not go further than an inch. Okay, so no organs. I can't feel any organs. All right, and then to name the organs that are in the quadrant. So your right lower is going to contain your cecum, your ascending, your right ureter, your appendix. Your right upper contains your liver, gallbladder, right kidney, ascending and transverse colon. Then your left upper consists of your left kidney, your transverse and descending colon, pancreas and spleen. And then your left lower consists of your left ureter, your sigmoid, and then your descending colon. And then midline would be your bladder, uterus, umbilicus, and the aorta. So maybe sit back up. I'm gonna look at your legs now. So color is appropriate, uniform throughout, no lesions. Okay, so the temperature is warm to touch. No edema is present in the legs. No hair. Now we're gonna check for your popliteal pulses right behind the knee. Okay, 1+ bilaterally. And your tibial pulse. 1+ bilaterally. And then your dorsalis pedis. so 1 plus bilaterally. Now I'm going to test your Babinski reflex. So I'm just going to stroke this on the lateral edge of your foot. So no flaring of the toes on either side. Okay, so now I'm going to have you stand up. We're going to do the Romberg test. Okay, so I'm going to have you arms to your side, feet together. Close your eyes for 20 seconds. Okay, so she's got a good balance, no dizziness or anything. Maybe open your eyes and walk to that corner and back. Okay, so gait is good. So, yeah, thank you for letting me do this.
Welcome.